A patient today wanted to talk about utilizing Vistaril or Hydroxyzine for their treatment of their anxiety disorder. They wanted to talk about this medication specifically because while we'll often look to SSRIs or selective serotonin reuptake inhibitors or SNRIs, selective serotonin norepinephrine reuptake inhibitors for the treatment of anxiety disorders, this individual stated that they weren't open to exposing themselves to a daily medication that could potentially have sexual side effects. And so this is something that comes up a lot, and patients are often concerned about it. And so he wanted to try a as needed medication, but this individual had a history of abusing and actually being dependent at times on alcohol. And so we wanted to avoid benzodiazepines like Xanax and Valium and Klonopin and Ativan because benzodiazepines actually work on your GABA receptors in your brain in a similar fashion to alcohol. And they also have quite a bit of abuse potential, and individuals can become dependent on those medications. And so in general, I like to try to avoid those medications if possible, or only use very sparingly. And in an individual with a history of an alcohol use disorder or a substance problem, then I'm really going to want to explore other options. So this individual had done their own research and said, hey, how about this Vistaril or Hydroxyzine? Vistaril is a medication that is chemically very similar to benadryl or diphenhydramine. Both benadryl and Vistaril are antihistamines. And so they can be used for conditions like pruritis or significant itching. They can also be used for insomnia because they can make you kind of tired. But Vistaril or Hydroxyzine was FDA approved for anxiety as well. Some of the side effects of Vistaril include dry mouth, constipation, which can be severe and can lead to a bowel obstruction, sedation, obviously, but that can actually result in excessive grogginess the next morning. In overdose, it could result in seizure. It could result in kidney failure. So it can benadryl for all these things as well. And confusion, mental status changes, and then arrhythmias. So if someone is taking even benadryl or diphenhydramine over the counter, or if they're on Vistaril or Hydroxyzine, you really need to take it the way that it's prescribed, follow the labels, follow the direction of your medical provider, because these medications can cause QT prolongation or other changes in your heart rhythm, fluctuations in your heart rate, and other issues that can be rather severe and could even be deadly. Vistaril or Hydroxyzine, just like benadryl, can make someone incoordinated, can make them less steady on their feet. It may not be safe to take this medication if you're going to be operating heavy machinery or driving a car. You obviously want to make sure, again, that you are under the supervision of a medical professional if you are going to be taking this medication, and you're only taking it as it is prescribed. These videos are meant to be informative only. They're not meant to be medical advice for anyone out there. So if you do believe this video pertains to you in any way, please set up a visit with a mental health professional. And again, Vistaril or Hydroxyzine is a medication that's FDA approved for anxiety. It does not tend to have the abuse potential, or at least not as much as your benzodiazepines or other anxiolytics. And it is a medication that can be taken as needed.